Good morning and welcome to Seeking Wellness, Our Bodies Explained on WPKN 89.5 FM. I'm your host, Dr. Jennifer Pierre, your neighborhood naturopathic doctor and public health advocate, bringing you the best of what integrative medicine has to offer. We broadcast from Bridgeport, Connecticut on the fourth Saturday of every month from 9 a.m. to 10 a.m. Here on Seeking Wellness, we discuss various health topics while clarifying some misconceptions about naturopathic medicine and providing education from a clinical and holistic perspective. If you're a longtime listener, welcome back. If you're new to the party, come on in, take off your shoes, and get comfortable. If you've missed any of our past shows, please log on to our website, wpkn.org, to explore our archives and podcasts. I hope you all are faring well as we've ushered in the new fall season. Lots of transitions going on, particularly with children getting adjusted to school. Make sure that you check out our last show on helping children cope through the pandemic. It was an excellent show with Dr. Stephanie Preston, and I think there'll be some great tidbits in there as you help your children get adjusted to their new normal. I also wanted to remind everyone, just make sure you're taking care of yourself. If you haven't been in to visit your physician for your annual exams, please make your appointments. Right now, as you know, there's telemedicine options where you can see your physician to check in if you need any medications that need to be prescribed. Just don't forget about that self-care and making sure you're healthy. Speak to your naturopathic doctor about any supplements that you need to be on, just to prepare yourself for this season that we have coming in. And just because there's a pandemic, do not forget that your chronic health issues still need to be managed and addressed. So keep that in mind. Today, we are talking about CBD and medical marijuana, particular cannabis. You may know it by that term. I wanted to have a discussion about this topic because I get so many questions about it. Sometimes people are a little nervous about it because they feel embarrassed because there's been a stigma on marijuana. And I wanted to speak about it from a medical perspective and just give you all the information that you need when you're making decisions about how you would use it, when you would use it, the difference between CBD and medical marijuana. So I have a special guest on today who we're going to have a great discussion about it. Everything you've ever wanted to know and maybe were embarrassed or didn't feel that you could talk to your doctor about it, or just didn't feel that you found the right person in general to talk to about it and get advice and the differences between CBD and marijuana, because there are some differences. So we're going to have that discussion and I hope you enjoy it. Full disclaimer, anything we're discussing about today, you have to discuss with your physician. So medical marijuana is something that should be prescribed if it is legal in your state, and you have to talk to your physician about whether it is appropriate for you and whether you need a recommendation for it. CBD is a little different in that you can get CBD without a prescription. However, you should be monitored by your physician as well, and a physician who understands CBD and how it should be used. So not all doctors are well versed in CBD, so please find a physician who understands it, understands how it works, and understands any contraindications for any other medications that you may be taking. I'm really excited today for our guest, Dr. Junella Chin. I have known Dr. Junella Chin for quite some time now. She's a fellow Cornellian, so that makes it extra exciting to have her on the show. But I'm going to introduce her and we're going to have an amazing conversation about cannabis and CBD and everything that you should know about that, and even how you can incorporate that into your life. Dr. Junella Chin, this is her bio. For over a decade, Dr. Junella Chin practiced medicine in California, specializing in osteopathic manipulative medicine, nutrition, acupuncture, and medical cannabis. Dr. Chin is currently treating both children and adults in New York and Connecticut. Dr. Chin is dedicated to thinking beyond the limitations of standard allopathic medicine. She has extensive integrative medical training, including nutritional biochemistry at Cornell University, Touro University College of Osteopathic Medicine in California, medical acupuncture at Harvard University, and research at Columbia University, Center for Complementary and Alternative Medicine and Women's Health. Dr. Chin is an advocate for better understanding of the science and medicine of cannabis. Dr. Chin and her team of physicians consult with patients all over the world. They have been integrating medical cannabis since 2001. Her work has been featured in Forbes, LA Times, CNN, Good Morning America, among others. The book she co-authored, Cannabis and CBD for Health and Wellness, was published in June 19. Thank you so much for being here, Dr. Chin. Welcome to the show.
Thank you so much for having me, Dr. Pierre. It's so good to talk to you and be with you.
So, tell the audience what you do, why you do it, and some of your specialty areas. Let's start there.
Sure. So, for me, the biggest reason for going into medical cannabis and integrating medical cannabis for my patients is I'm a chronic pain survivor. So I don't know if you remember, but when I was in college, I would wear a back brace. I was always in pain, and I went to medical school, always in pain. I have an autoimmune disease of the spine called ankylosing spondylitis, which is a mouthful, but it's AS for short.
Mm-hmm, mm-hmm.
So what ends up happening is your spine fuses. It fuses on its own. You lose mobility, and there's no cure. And so when I was in med school in California, I was just at the right place at the right time. One of my attendings offered me medical cannabis, and when it worked, it changed the trajectory of my practice and the rest of my career as a physician.
Wow. Did you ever have, at that time, this was years ago, did you ever have any apprehension about cannabis at that time, or things you might have heard that could have skewed you in either direction?
I definitely had a stigma towards cannabis. I grew up in the Bronx. I grew up in a very traditional Asian household. And so there was a huge stigma about cannabis and what it represents. So when he offered medical cannabis to me as a attending, and I was a med student, I was shocked. And I really, it took me, it took me several weeks before buying into it and realizing if I didn't try some alternative method for my pain, I wasn't going to be able to become a physician and even finish medical school.
Wow. So what was your process in this becoming the focal point of your practice?
So when I finished school and I was practicing in California, I didn't tell anyone that I was helping patients integrate cannabis. For a long time, I was afraid of what my colleagues would say. I remember I told a close friend that was a classmate of mine that I said, I'm helping patients with medical cannabis and it works. And this was originally kids with seizures. And she said, Janella, did we even go to the same med school? She's a pediatrician. She's a pediatrician at Kaiser now, and she's a hospitalist. And she like looks at me. She goes, "You do acupuncture, you do osteopathy, you do medical cannabis. Like we
How
were
did
not
that
taught.
happen?
We are not taught these things." But for me, I look at the big picture. I look at everything in a very integrative and holistic way, and that what helped me with my chronic pain.
Wow. And would you say that when you were incorporating this into, your regime, was it mind blowing to you how helpful it was? Or, what was that for you, just taking that in?
For me, going through the regular allopathic route of prescription medications, I got injections, epidurals, trigger points. I did everything under the sun and took every prescription medication. So when that didn't work and I started integrating natural supplements, changing my diet, acupuncture, rolfing, osteopathy, I started to notice that my body was actually healing from within and I didn't really need to rely on prescription medications around the clock. And then when I added medical cannabis, it was icing on the cake. So for me, I thought, well, if this worked for me in my chronic pain, how could I apply this into the health and wellness of my patients that are looking for more?
Wow. So while we're talking about it, Dr. Chin, I want you to give the audience kind of a primer on just what cannabis is, and just what the endocannabinoid system is in the body. People don't realize that we already have these receptors in the body. So could you break that down in a way that the audience can understand, so they can really get a clearer picture of how it works in the body?
Sure. So, to understand how cannabis works with your body and your brain, you have to think about some of the other systems in your body that you're probably familiar with: your digestive system, circulatory system, your respiratory system, your nervous system. So the endocannabinoid system, or ECS for short, is another system in your body that was discovered a little bit more recently, but it interfaces with all those other systems. It actually it has a really strong interplay. It's called the master regulator, and the digestive system and the circulatory system cannot work without our endocannabinoid system.
Mm-hmm. And is there anything, the idea that we already have these receptors in our bodies? Can you talk a little bit about that, like, and
Sure.
what happens when we actually do take cannabis or CBD oil?
Sure. So our endocannabinoid system, because it helps regulate the other systems, we can do simple things naturally to up our own endocannabinoid system. And that's getting
Mm.
enough sleep, that's exercising, that's eating well. But sometimes it comes to a point where our body just can't self-regulate. We need a little bit of help, we need a little bit of nudge. And that can come from the plant, the cannabis plant. Now, the cannabis plant composes of the hemp plant, and you have the cannabis plant. So the cannabis plant has THC in it, and THC is the part of the plant that creates this sedating, euphoric effect. It gives you that
Mm-hmm.
nice relaxation. Now, CBD is the other portion of the plant, which you hear about all the time.
Mm-hmm.
CBD is an anti-inflammatory, is an anti-pain, and what's wonderful about CBD is you don't have to worry about feeling sedated or high.
I
And the
think
hemp
that's,
plant,
yeah.
yeah, the sorry,
That's,
and
no, I was
the
just going to say that's the huge difference I think people need to
exactly,
hear.
exactly, and the hemp plant is bred without THC. So that's the beauty. So I mean, I would think of hemp and cannabis, they're like cousin plants, but the hemp plant just doesn't have THC in it.
And that's why we hear about hemp with like hemp bags and very natural products that are made out of hemp. It's also really good as far as sustainability, and it helps the soil actually to rejuvenate the soil when it's planted. So two different things, but like you said, I like what you said about being cousins, very similar but different.
Hmm.
And is it true that most of the, because I've seen this in practice, that most of the CBD products that we use, they are coming from hemp, correct?
Yes, most of the CBD products that are over the counter that contain less than 0.3% THC come from hemp.
Wow. And that's, I think that's another distinction that people need to really understand. So tell me a little bit more about, what makes you decide whether you're going to, because you have extensive history in using cannabis. How do you decide when you're going to use CBD oil versus cannabis?
So it really depends on the patient's symptoms, the patient's goals, also their lifestyle, what they do for a living, if they're working, their age. So, for example, I have a 80-year-old woman with Parkinson's disease, and she's tried the over-the-counter CBD oil, and it really helps her with the muscle spasms and the pain, but she lives alone. So that's not someone that I would really add a lot of THC with, because we're
Mm,
worried about fall precaution. We're worried about her, getting dizzy or feeling altered in any way. But I have a 50-year-old, also Parkinson's, and he works. So he's an attorney. He still continues to work. He's mobile. He commutes to work and he makes sure he's exercising. So when he took the CBD oil, it helped with the muscle spasms. It did help with the overall pain, but the actual tremors was still there. So we added a touch of THC, which he gets from the dispensary. He has a medical cannabis license, and he knows how to dose it very, very carefully so that he doesn't feel altered while working, but
mhm.
it's just enough to stop the tremors so he can sit through a meeting and not worry about the tremors.
Wonderful. So while you are already kind of going into that, let's kind of switch gears and talk about what that process looks like. I know you practiced in California for a while, and as we all know, there's always jokes about how readily available cannabis is on the West Coast. But since you already started talking about it, can you tell us a little bit about what that process is in New York and Connecticut, and maybe even some differences in how you practice?
Absolutely. So in with the West Coast, it's a very open free for all. There's more dispensaries than Starbucks, and it's not very well regulated or very strict process. On the East Coast, it's a very regulated program, both in the tri-state area. And to be honest with you, I sleep better at night practicing in New York and Connecticut because it is so regulated. So when you go to the dispensaries to pick up product, it is been tested by the Department of Health and
Hmm.
it is traced by the Department of Health. So you, in New York, for example, you pick it up from a pharmacist. The pharmacist works at the dispensary. And the same thing in Connecticut. And that, when you pick that up, it gets logged into the prescription monitoring program or the PMP. And you and I will tap into that, when we write a prescription for our patients and we can see what they picked up.
Hmm. Yeah,
Hmm.
that is an incredible difference. So that doesn't happen at all on the West Coast.
No, not yet. I don't know if they're trying to instate that, but what I like about that here is I know what the patient picked up. I can monitor and make sure that they're, doing things safely. Or if they say, you know what, that didn't work, and then I'll say, well, what did you pick up? They always say, I don't know. The retailer gave it to me, and I'll look it up in the PMP and I'll say, oh no, this is not what I recommend. Let's try this and this instead. And so I think it's a more of a medical model, a robust medical model compared to the West Coast.
Oh, wow. That was really helpful in breaking that down. I wasn't aware of that happening in the West Coast. I thought it was because it's been legal for so long, I thought there was more of a system behind it. So that's helpful to know, especially in terms of safety. Um, so, what are some of the myths that you have heard, especially practicing with patients? And you kind of alluded to when you were talking to a colleague who also went to medical school with you, and how they were kind of shocked at all the integrative therapies that you're into. But that kind of goes along with some of the myths that people have about CBD and cannabis, and again, the stigma. What are things that you've heard even from some of your patients who have come to you interested but maybe a little embarrassed, or what have you heard from them?
I think the most important thing is that we often get locked into this one size fits all thinking. And so when you're working with plant medicine, there isn't one size fit all. And in medical school and in residency, we have this like, oh, this is how we've always done it. That's like the conventional allopathic medicine model. So I can
Hmm.
understand why my friend and colleague looked at me, when I started integrating plant-based supplements. But we also have to understand, I think, for patients, is that CBD is not a cure-all, even though it's
Hmm.
being marketed that way.
Hmm.
It can be very effective at certain doses, but it's not a silver bullet, and it's very helpful to talk to a practitioner, a healthcare practitioner, an MD, a naturopath, a DO, because there's these nuances that you have to understand when incorporating plant-based medicine. You don't want, I mean, you want to go all natural, but at the same time you don't want your body to downregulate and start being lazy and not produce things on its own. You're bringing your body back to equilibrium, but you don't want to rely on all nutritional supplements and all CBD. So there are things like, obviously your diet and exercise, acupuncture, other things are all pieces of the puzzle.
Yeah, that's really important that you highlight that, because there are many people now, we always make the joke, Dr. Google. People are
Yes.
consulting Dr. Google, and they're looking for dosing information. And I've had patients approach me with all types of crazy things that they found online, and they're like, "What do you think about this?" And I'm like, "What? Like, where did you get this? Um, it's fun. Like the things that my patients find sometimes is astounding to me. The supplements they find online or the different CBD products. And I'm constantly stressing the safety because patients don't realize about, they're not as knowledgeable many times about quality control, third party testing, and all that goes into it. And especially if you're talking about something like CBD quality and cannabis, and not realizing that things can be mixed and laced and all this kind of crazy stuff. So, while we're on that topic, can you talk a little bit about what forms are better in dosing, or just a breakdown of full spectrum versus isolate versus synthetic? There's all these terms that people hear. And yes, I'm going to stress again that you should go see a doctor who has this information. Not every physician has the information about CBD oil and cannabis. So please, as you're going along this process, please go to a physician who has the knowledge base, preferably an integrative physician, like we mentioned before, a naturopathic doctor, an osteopathic doctor, someone who has more of an integrative mindset. But let's talk about those differences between full spectrum, isolate, and synthetic, and what you've seen in practice and how you use them.
Sure. So CBD is available in different formats. Full spectrum, it means that that formula has utilized the full range of the hemp plant's compounds. So there's terpenes, it's what give cannabis that pungent odor. There's different cannabinoids, and there's up to 0.3% of THC. That's US's current legal limit.
Mm-hmm.
Broad spectrum contains the terpenes and the cannabinoids, but zero THC. So you don't have to worry about THC at all. And then there's isolate, which is everything is removed. So there's no more terpenes, there's no other cannabinoids. It's only the CBD molecule.
Mm-hmm.
So there's different ways of taking it. And again, it really depends on your goals. I have patients on broad spectrum because they get drug tested. So they can't have any
Mm.
THC in their body. Full spectrum patients like it because they find that they might get more clinical effects because you're using the whole plant compound.
Mm-hmm.
And then isolates are used usually in compounds where there's needs high dosing, or if you're trying to use it as a pharmaceutical supplement.
Mm-hmm. And that's the one I would say, a lot of my patients are using and find to be helpful.
Mm-hmm.
Um, so what are there any conditions you would say that CBD is not helpful for? Because in my mindset, there's so many different things that I've found it to be useful for. Anxiety. We talked a little bit about pain. Um, I mean, is it not useful in certain conditions, or what would you say are like those high target, amazing for this, not so much for this?
Well, if you think about the CBD molecule, because it's such a potent anti-inflammatory, it's 10 times more potent than steroids. So inflammation, as you know, is the root cause of most
Mm-hmm.
diseases, right?
Yes,
I mean,
yes, yes. I'm talking
so
about that all the time with my
yeah,
patients.
exactly. So because inflammation is the heart at most diseases, that's why it seems to be this panacea. Like, oh my God, I can't believe it works for, migraines all the way to anxiety, PTSD, and then it works for my diabetic neuropathy foot.
Mm-hmm.
So the reason is because of inflammation. When you have this chronic inflammation, it brings down the inflammation quite effectively. But, again, CBD doesn't cure everything. You have to supplement it with other things.
Yeah, and this is the conversation, in our world of integrative medicine that we're having all the time. I think people, so right now, so many people are afraid of medication and prescriptions, and due to the opioid crisis, I think people are just very wary of medication and the side effects. So they kind of want to replace medication with something natural. And so that's what I'm constantly hearing from patients. Can I just take something that's more natural because I don't want to take this drug and the side effects, but not realizing the amount of work that they have to put into it. And it's good work, right? It's things that you want to be doing. It's setting a foundation not only for yourself but your family. I say to patients all the time, especially my female patients, when you are setting the groundwork for your health options, right? You are able to set that up for your children, your partner, whoever is in your life, you're able to do that. So what we're talking about today is, I speak about this ad nauseum, and I'm sure you do with your patients as well. We want a holistic view of the body and additionally for treatment. So we're going to keep driving that home, that you have to do the diet, the exercise, even the self-care, along with trying these therapies. Um,
Absolutely, absolutely.
would you say, so, in my mind, when we're talking about inflammation and preventative medicine, do you see CBD and cannabis having a large role in maybe disease prevention?
Oh, yes, for sure. I mean, there's this whole universe of regenerative medicine, obviously nutritional medicine, preventative and integrative medicine, and I think CBD can be at the heart of that. So when you're integrating CBD and you're cutting down inflammation, and it's like you're parting the storm, because when you cut down inflammation and you wake up feeling less stiff, maybe you can do that 10-minute walk down the street and get your lymphatics going. Maybe you can have, less sugar in your diet for the week. So I think CBD is sort of kind of is a stepping stone to a more healthier lifestyle. And right now, with this pandemic that's going on, I'm
Mm-hmm.
busier than ever because everyone is realizing, like, I need to like do stuff that's preventative. I can't wait until it's too late. I need my immune system to function, to boost my immune system. I need to eat better. What's going on, with my weight? I gained all this weight during the pandemic. So
Mm-hmm.
I think people are starting to open up their eyes.
And tell me about that. Like how has your practice changed during the pandemic? We've all been affected in certain ways, but you mentioned your practice, the need has increased. So tell me a little bit about how that has affected your practice and what you're seeing people come in for the most.
I feel like we have more the attention of our patients now more than ever because they
Mm,
are not going out as often, less distractions. Maybe their work schedule has decreased a little bit, so they're doing a little bit more reading and self-care. So insomnia is one of the things that my patients have been complaining about, anxiety and
mm-hmm.
inflammation. But they're realizing when they do call their regular MD for telehealth, their MD will say, okay, well, here's a prescription for a muscle relaxant, or here's a prescription for Ambien. It's good luck.
Mm-hmm.
That they walk away like, wait a minute, I would rather try and regulate my circadian rhythm, my sleep cycle
Mm-hmm.
on my own or with a natural supplement. And that's where, we can talk about nutritional supplements, we can talk about sleep hygiene, and then adding CBD as part of it.
Wow. And you recently moved into Connecticut, which I'm really excited about because I'm going to be sending lots of patients your way. But what was your process in deciding that you wanted to expand into Connecticut? Our listeners are right in your area. So what was that process like?
Absolutely. Well, it was convenience because I live in Westchester, so I'm only about 20 minutes from Stamford. So it was convenience, and I was not traveling into the city as much, into New York City. We had an office in Midtown on Madison Avenue and 33rd Street. So it was a strategic move because all my patients from the city went out. So they went
Mm-hmm.
into Westchester or into
Yes,
Connecticut.
yes. Yes, that's what we've been
I
seeing here. It's like New York at large has moved up and into Westchester and Connecticut. Everybody's running from the city now, which is really
Ex-
interesting.
Exactly. So really, it was actually out of necessity. Some of my patients couldn't get into Connecticut physicians, and they said, "Do you know of anyone here that can help me integrate medical cannabis?" Because the laws are, you have to follow the laws in the state that you reside in. So if you reside in
Mm.
New York, you have to find a New York doctor to give you
Mm-hmm.
medical cannabis. If you reside in Connecticut, you need to find a Connecticut physician. So now that I'm licensed in both states, I'm able to help.
Amazing, amazing. So let's talk about some populations. So I was on a webinar that you did recently. It was amazing. And you were talking about the possibility of using CBD oil during pregnancy and just kind of like, some potential contraindications or how it may be helpful and just some of the research behind that. Could you talk a little bit about just where we are as far as using CBD oil during pregnancy?
Sure, sure. So that endocannabinoid system that I mentioned before is really a complex biological system. So it's even involved in fertility, ovulation, prepping your uterine lining, and implantation of the embryo. So I wouldn't give a blanket okay and say, okay, you can use CBD or cannabis during pregnancy. You have to really look at the relationship of the mother's health, obviously of the embryo. So there's not enough research to prove that CBD and THC is 100% safe with
Mm-hmm.
pregnancy.
Mm-hmm.
However, with that said, a lot of my pregnant moms will end up using topicals. So topical CBD,
Mm-hmm.
because it doesn't get absorbed, you don't have to worry about it affecting the baby. So you can apply
Mm-hmm.
it to your low back or your sacrum, or
Yes.
there's areas that are giving you a hard time, even your TMJ joint, which which really
Mm-hmm.
gets aggravated during pregnancy. So that could be a good thing to use. And then there are some moms that find that CBD can be very helpful for morning sickness. And the reason why CBD helps with morning sickness is because it works on the serotonin receptors. So it can help alleviate nausea and vomiting. But my first go actually to get rid of morning sickness would be acupuncture first. So if the
Mm.
acupuncture doesn't work, then maybe you can start thinking of other things.
Do you do acupuncture as well?
Yeah, we do.
Ah, I didn't realize that. I adore acupuncture. My patients know that, but I didn't realize that you did that as well. That's fantastic. In combination with everything else that you're doing. So I hope you were listening, pregnant moms. I treat a lot of women for infertility and reproductive health, and that question comes up pretty often. So I wanted to make sure I had you address it so people can have an idea of where we are with the research. So it's not a blanket statement, but there you can definitely use it topically, for those pains and issues that women have during pregnancy. And another population that I wanted to talk about is children. Tell me about your work with children and how you've used cannabis and or CBD with children.
So the largest, I would say, population that come see me are kids with autism. And kids with autism will either have GI issues, where like an irritable bowel type
Mm-hmm.
issues,
Yes.
or epilepsy or self-injurious behavior. Maybe they're, maybe self-regulation or ADD. And so what I have found is that CBD really helps temper ADD, calm the nervous system down. Because CBD is great as an anti-inflammatory, it helps decrease the inflammation in the GI tract for a lot of my autistic patients. And then with seizures, we do have CBD used for seizures. Most of those patients do get a little bit of THC as well from the medical dispensary.
Hmm. And there was a recent story. I'm not sure if you heard about this. It was some story about a child who had previously been using CBD, and unfortunately, it was used for much of her care and her pain. But unfortunately, she had passed away. No connection to CBD, but it had helped in her care. Do you remember that story or who that patient was? I think it was part of that brand Charlotte's, something
Yes,
like
that's
that. Are you
right.
familiar with
Charlotte's
that?
Web. Uh-huh.
Yeah, there was
Yeah.
so much around that. Do you know, about that, her particular case or her care?
Absolutely. So she had an intractable epilepsy. Means she tries everything under the sun, all standard of care prescription medications, and she couldn't get her seizures under control. And her parents found CBD to be extremely helpful. And I have cases of that. Dravet syndrome, which is a seizure disorder,
Mm-hmm.
and these kids are seizing over 100 times a day. a
Wow.
hundred times a day. And so some parents, they try CBD and cannabis, and when they find that it's working, they bring it up to their neurologist, and usually the neurologist says, "Well, I don't know enough to really
Mm-hmm.
help you." And so then those moms usually go on Facebook and try to figure things out through their community. So it's a little tricky. You have to be able to find, I think, a health practitioner that understands how to integrate cannabis medicine and also work with the neurologist at the same time, so there can be a team approach.
And as we're talking about that, I wanted you to talk about some of the pharmaceuticals that have been created to kind of mimic how cannabis works in the body. One in particular, Marinol. Can you talk about, that synthetics and maybe even some other things that are on the horizon as far as medication goes?
Yeah, well, Marinol's been around since the 70s, and Marinol you can find most, oncologists will prescribe it for, either increasing an appetite or decreasing nausea. And it's a synthetic cannabis, so it's only THC. So there's no CBD in
Mm-hmm.
it, and the THC is then synthetic. So clinically speaking, when my patients try Marinol, they feel very uncomfortable. They tell me they want to crawl out of their
Mm.
skin because it's only
Wow.
THC. So there's no temper. And that's because back in the 70s, they thought THC was the therapeutic portion of the cannabis plant.
Mm-hmm.
There was no talk of CBD or even other cannabinoids. So there's Epidiolex, which has recently come out by GW Pharmaceuticals, and Epidiolex is the FDA approved cannabis extract for seizures.
Got it. And then
hmm
have any of your patients been using that one as well? And what have you seen with that? Or,
Yeah,
um,
Epidiolex, you have to get a pre-authorization. It's very expensive. So we do a lot of paperwork to get the patient on a
mm,
program for Epidiolex. Otherwise, it's just not affordable. But most of my patients that do go through the Epidiolex program is also seen by a neurologist at NYU Langone's Epilepsy Center. So there's Dr. Davinsky, the Dr. Bluestein. So they're really wonderful, and they were actually the principal investigators for that FDA approval of Epidiolex.
mm.
Hmm?
Okay, great to know. And of course, as we're talking about cannabis and CBD oil, I'd be remiss if I didn't have a special section on oncology and what you've seen as far as using them with your patients. I think medically, that's what we hear the most about how it's being used. So what does that look like in the populations that you've treated?
Right. So I get a lot of referrals from the different cancer centers, including Sloan Kettering. A lot of patients, when they go through chemo radiation, they're given a cocktail of 10, prescription bottles, and they take that home. And so a lot of patients, they look at that and they say, "Oh my God, I just don't, want to tax my body anymore. The chemo and radiation is enough. I have this anti-nausea pill, and then I have this stool softener, and then I have this
Mm-hmm.
this pain medication." So they want to try something more natural, and when they do their research, cannabis comes into play. And cannabis is great because it can potentially eliminate your anti-nausea med, your pain med, your appetite med. So if you can eliminate three or four different prescription medications and allow your body to heal a little bit more naturally, then I think it's a win-win for all.
Oh, that sounds incredible. Thank you for sharing that. And then let's talk a little bit about this book that you co-authored
Oh
last
my
year, so
goodness.
June 2019. Tell me about this.
I know, I know. So it was so much fun. I did it with Eliza Sherman, and we did it through Penguin Random House, and we did a whole book tour on the East Coast and on the West Coast in 2019 in the summer. So it was really really great, and
Mm-hmm.
it's a very comprehensive book, and it's an overview of all things cannabis,
Mm-hmm.
so and CBD, so you can understand how it works and how to use it. But I think the most important thing about the book is, we are women authors and we're cannabis users. So our empathy and our intuition and our determination to find a way to take charge of our own health really defined the book as we were writing it. So I do
Oh,
recommend it to anyone that's looking for an integrative or holistic approach to their health and wellness.
oh,
Mhm.
perfect. And then it'll give people kind of like a breakdown of what we've been talking about today as well. They can get more into that.
Absolutely. And there's also patient cases and vignettes. So you can see examples of, how I might have treated a, PTSD patient, or a patient with anxiety and insomnia, or a patient with Parkinson's.
Fantastic. And then what do you want to leave the audience with before we wrap up? What do you want to share, or if anything else we haven't covered today, what would you like to put out there as far as patients considering using one or the other, cannabis or CBD? Tell me what you would like to put out there.
I really think that the CBD and medical cannabis movement is a wake-up call to our current healthcare system. Our healthcare system, and, even, you and I going through medical school, we realize it's very poor at addressing how to prevent disease, right? So we want to we have a disease target kill model. We want to take a pill quickly. We want the disease to be dead, and then we move on with
Mm-hmm.
our with our life. But I think what this whole movement, of cannabis is really, how do we take control of our life? How can we be more proactive in our own healthcare?
Wow, I think that's a great way to wrap everything up. So let us know, how can we contact you? Where are you on social media? Give us information about your practice in Connecticut. Where are you?
I'm in Stamford, in Connecticut, but you can find me in social media or my website, which is drjunechin.com. And you'll have my contact information, my office numbers, and a little bit of background on myself. And just give me a call or an email to see if this is, the right direction for you. I don't charge for the initial call. So even if it's like a 10-minute, like, let's chat and see if this is
Hmm.
something, worth pursuing, for example. I think we all need to get more educated, and really take control of our own health.
Fantastic. Thank you so much for being on the show, Dr. Chin. I'm so excited that we were able to connect. I'm so excited that our paths have interconnected in this way. I don't think all those years ago we knew that although on different paths that we'd wind up kind of linking up in this integrative medicine world. And so I mean, it's crazy, right? But I'm
Yeah.
excited to the fact that we're on this podcast even today, having this discussion. And I congratulate you for your journey and how you were able to step outside of the allopathic model and really, it's not easy. It's really not easy to do that. So I'm happy for you that you decided to take this direction, and for all the people that you've been able to help since that time.
Well, thank you so much for having me, Dr. Pierre. It was
Of
really great
course.
talking to you and your audience.
Of course. So please reach out to Dr. Junella Chin. She's an amazing physician and another physician who is on the ground incorporating integrative medicine into her practice and healing so many people. So thank you so much for joining me.
Thank you.
Thank you so much for tuning in to the Seeking Wellness Show today. I'm your host, Dr. Jennifer Pierre. You can reach out to me at my website, drjpierre.com, on Instagram at drjpierre, or on Facebook at Dr. Jennifer Pierre. Please be sure to check out the website, wpkn.org, for past shows, and meet us right back here, same time, same place, on the fourth Saturday of the month for another informative topic. Enjoy your weekend, and most of all, please stay healthy.